afternoon. This is Dr. Thomas Dobbs from the State Department of Health, and thank you all for joining me today. We have a lot to cover, but we'll just go ahead and start with the essential numbers of the day. Today, we're reporting 905 additional COVID death cases and 36 additional deaths. If we look at our total deaths, we have recorded 3,581 deaths, and we even know that this high number is an undercount. I would like to remind everyone that a lot of these deaths were preventable, and many deaths in the future will be preventable as well if we just do those simple things that we know work to prevent the transmission of coronavirus. If we look at our hospitalizations, we can continue to see increasing stress in our hospital system. We have a total of 821 COVID hospitalized patients with 207 in the ICU. We continue to see increasing numbers of COVID hospitalizations, ICU utilization, and additional stress on the hospitals. There's been some variability over the past week with availability in ICU beds. Hospitals have been trying very valiantly to make sure there is space available. Some hospitals have delayed non-urgent elective surgery so that they can make hospital rooms available. It's something right now that they're doing quite well with, but we'll monitor very closely because we are right up at the margins of our capacity as far as hospital bed utilization, especially around ICU beds, but also staffing strains are starting to accumulate. And I'll go ahead and go to some of the different questions that we've received. One of the questions we received is on the PPE. Do we have sufficient amounts of PPE? At this time, it does seem that the normal supply chain is able to keep up with the demands of nursing homes and hospitals. We haven't had any issues of significant shortages. In addition to that, we are continuing to beef up our state stockpile, and MEMA's done a fantastic job. And we have a minimum of 60 days supply for pretty much our entire needs for PPE that we could share if we get to that point. And we have in some items, we have up to 120 days. There was some question about ventilators and the availability of ventilators and how many do we have. We have a total of 1,048 active ventilators, of which 589 are not currently in use. In addition, we have an additional 710 reserve ventilators. Some of these are not going to be as frontline ventilators that we want to use, but we can use them if we need to. But if we look at really where our shortages are going to be, it's not most likely going to be within ventilators or even beds. It's going to be staff. And there are highly specialized staff, ICU nurses, respiratory therapists, and also critical care physicians who know how to take care of those people who are most sick with coronavirus. So if we want to make sure that someone who's ill and hospitalized in ICU coronavirus has the best chance to get well, they need to have that highly trained personnel, and that cannot be flexed up rapidly. So we want to make sure that we're utilizing our resources as efficiently as possible to the benefit of our state. But the best thing that we all can do is to make sure that we limit transmission of coronavirus so that we do not overwhelm the healthcare system. We are kind of getting up right at that level, unfortunately. I had a question of what does the worst case scenario look like? Well, that's hard to say for sure. I mean, it can be really bad, but certainly we could see situations, and we may see in the near future, where people who need healthcare are not able to get it. It's not just for coronavirus, right? If we have depleted our hospital capacity, people who have other critical illnesses, car wrecks, heart attacks, strokes, other forms of pneumonia are not going to be able to get the care they need. So stressing out the healthcare system and people dying unnecessarily because they don't have access to care, that's a real possibility, but it's also something that we can turn around if we make the right actions. There was a question about the availability of testing throughout the state. We continue to see increasing demand for testing, which is not surprising. In Mississippi, our testing demand has very much sort of mirrored the case burden and the number of people, because most people get tested when they are sick, they have symptoms of coronavirus, or if they are having issues with their family, like they have a close contact. So when we see more outbreaks, when we see more symptomatic cases of coronavirus, we're seeing more demand. And at our county testing units, we've actually filled up for many days in a row at several locations and adding additional capacity. But from the Department of Public Health and UMC National Guard partnership, we do have testing available in every county. In Hinds County, we have the farmers market site where we test every day, Monday through Saturday. Other counties, pretty much most counties, except for some of the very smallest ones, we will have testing available twice a week and continue to have capacity in those testing. We're not running out of tests. Our lab supplies are not being depleted at this time. And we know that our doctors are busy, but we continue to test a lot of folks. So If you're sick or if you're exposed to coronavirus, we still strongly recommend that you get tested for coronavirus. I was asked to make a comment about holidays. Holidays are going to be a very vulnerable time for us. Holidays are a moment when we get together with the people we love, but we're close to one another. We're eating, and when we're eating, we know we're not wearing masks. And we're with people we love and our family, we're not going to wear masks. And the other issue is we're going to have people who are of different age groups mingling together, right? Younger folks who are more likely to have the disease, older folks who are more likely to die from the disease. It's a perfect storm for an explosive outbreak of coronavirus. And if we look out over the recent history of coronavirus, we've had these certain inflection points that have been adversely impacted by holiday times. When we had Memorial Day, we had a spike. When we had 4th of July, we had a pretty nasty spike. Didn't see as much around Labor Day, thank goodness, but after Halloween, we have seen a lot of cases related to Halloween, social events, and increases from there. We don't want Thanksgiving and Christmas to be that sort of thing. So please, as you look toward making your holiday plans, keep it small, primarily keep it nuclear with your close family, because we all want to be able to spend future holidays with our loved ones and not have to worry about making folks sick. And we will see deaths, absolutely, around holiday gatherings. There's a question about mask mandates and if they are the law. The executive orders from the governor are the law and they're legally binding. And in counties where they are applicable, it's very important that we follow that law, because not only is it the law, but we know it's important to prevent transmission. So please follow the mask mandates. And even where they're not mandates, the Department of Health, we strongly recommend, very strongly recommend people wear masks at all times when in the public. But additionally, right now, especially, don't go out if you don't have to. Avoid indoor gatherings. Where transmission occurs is primarily going to be indoors, where you have some close proximity, larger number of people, and people not wearing masks. And eating indoors or having social events where you eat indoors are going to be very risky events as we go through the next few weeks in this fall surge. We do have 2 new public health orders that we distributed today. One of them was an update of the isolation order. So we have a public health officer order that mandates that anyone who is a known COVID patient, so if you know that you're diagnosed with coronavirus, then you need to go ahead and stay home for 10 days so that you don't infect other folks. And that's something that's been in place for a long time, but we did update it for a 10-day duration, consistent with what we understand about the coronavirus now and the CDC guidance. In addition to this, we did add a quarantine public health order so that those who are family members, if you live in the same household, you need to go ahead and quarantine. And quarantine means that you need to stay home after you've been exposed, so that if you become ill, you're not going to expose people during that window of time between your exposure and illness. We are getting inundated with new cases. The home quarantine is something that we do naturally when we do our case investigations, similar to our action in the summer with isolation order. We want to preemptively provide that guidance in a public health order for quarantine for household contacts, because we know they're at high risk for getting sick. It can be up to 40% of household contacts are going to get sick with coronavirus, and even higher sometimes. So if you're a household member of a coronavirus patient, you need to go ahead and plan to quarantine at home. There are options to work if you're essential with some specific guidance and safety measures, but that stuff is available on our website, and we'll be happy to talk about that more. On the positive front, we do have exciting news about vaccines. We've all heard about the Moderna and the Pfizer vaccines, which have both shown 90% or plus effectiveness, at least for a short period of time. This is very exciting. We haven't seen much in the way of any safety concerns so far. We do anticipate and eagerly await possible early distribution of vaccine, especially the Pfizer version, December possible. And we're going to continue to work with our planning efforts to make sure that we can start rolling that out with our phase 1 for healthcare workers and then highly vulnerable people, such as nursing home residents, immediately thereafter. If we look at antivirals, we have a new antiviral that's out. Bamlanivimab is a monoclonal antibody that is being distributed to Mississippi hospitals as we speak. We have been given a total of 370 doses distributed to Mississippi hospitals thus far that are in transit. And this is a treatment that's going to be for high-risk people who are diagnosed with coronavirus before they're hospitalized. So it's only for outpatients to prevent hospitalization and severe illness. And it's something coming to a hospital near you that can be used to give to folks who are high risk so that they don't have to get so ill. We'll have a small distribution to begin with, but we anticipate that we'll have more and more as the weeks unfold. We were also asked about our Binax kits. We've received 286,000 of the Binax tests so far. We've continued to use them primarily through our drive-through sites where we do rapid testing at the county health departments for anyone who has symptoms or has been in close contact to a case of coronavirus. Also have shared with our partners, including community health centers where they have the school-based clinics, and also assisted living facilities and other nursing homes that don't have access to rapid testing. We will continue to work on that distribution plan, try to use it as effectively as possible. There were some conversations about the COVID vaccine plan. One of the questions is it final? It's a living document. We continue to evolve, although I think the foundational principles are intact. Funding, we certainly will need additional funding to make sure this vaccination effort can go forward successfully. There's a lot of effort that's involved with this. There are federal conversations in Washington about that. There's an $8.4 billion ask to make sure that this is successful. We don't want to invest all this money in the coronavirus pandemic. The billions we've spent on Operation Warp Speed, and then the trillions we've had to spend to support the economy and people's well-being. We don't want to get to that last few miles and not do it properly. So funding is going to be a very, very important component. Allocation, the initial allocations will be, as we mentioned, primarily for healthcare workers and then people at the highest risk. They will be primarily sent through different hospitals and planned closed points of distribution. This is an emergency planning effort that we do year after year after year, so this is nothing new or surprising. So most people who work in the health system or hospital will be able to get it through that mechanism, but we also will have drive-through locations. The plan is right now with our county locations, so that anyone who is going to be within those phase 1 groups can get it at a county health department site if you're not part of a previously identified closed point of distribution. And that's another way that we'll reach rural citizens. And then there was a question of, have we heard from President-elect Joe Biden's transition team? And we have not heard anything from them thus far. And at this time, we'll go ahead and throw it over to Dr. Paul Byers to give us an update on schools.
Hey, thanks, Dr. Dobbs. Hey, everybody, I'm Paul Byers. I'm the state epidemiologist at the Department of Health. And want to talk a little bit about what we're seeing in the schools. And we've seen in other settings with the increases in the number of cases that we're seeing statewide, we are starting to see a more significant impact on the schools. Just to kind of give you an idea of where we are. And the schools report to us on a weekly basis the number of cases that are reported to them in teachers, the number in students and staff, the number of students and staff that they have on quarantine, as well as the number of outbreaks that they identify in a given setting in their school on a weekly basis. And when you look at where we are now with the number of students that were on quarantine the previous week, and that's what this week's report reflects, more than 14,000 students in Mississippi have been placed on quarantine in the last week. That's compared to about 9,000 in the previous week. So you see that things are starting to really heat up. When we look at the number of cases in students, we moved from about 500 or so cases in the prior week to over 1,000 cases in students in the current reporting week. We've also seen some increases in the number of cases among teachers, moving over 500 cases in teachers. Last week alone, we reported more than 70 new outbreaks in school setting. So we're really starting to see a much bigger impact on schools. And, one of the questions that we're asking schools now is, have they had to go virtual because of, increased numbers of cases, increased numbers of students and teachers on quarantine? And we know that has an impact on the schools too. Whenever they have to have all of those absences, that can make it difficult for them to maintain on campus or in-person learning. And so one of the questions we're asking now is, have you had to do a temporary dismissal because of that? And we have upwards of more than 65 schools that have reported in this last week that they've had to temporarily dismiss their class and go virtual because of either outbreaks or an increased number of students and teachers who've required quarantine. And just to kind of look at it, we have received a number of questions about the schools and reporting and some of the other specifics in schools, and we can go through those briefly for just a moment. One of the questions is how often are schools supposed to report? And that reporting is weekly. We have about 1,200 schools in the state, and about 880 schools reported to us for this last week. So that's a pretty good percentage of the schools reporting to us. It's important to get these schools to report. This is how we sort of have some visibility of what's going on in the schools, but it also gives us an opportunity to reach out to those schools where we identify that there are increased cases or outbreaks to provide them some one-on-one guidance. We do have guidelines for the schools for identifying individuals who may be contacts and recommendations for quarantine, recommendations for how they can prevent transmission within the school setting, and we have those on our website. And we are in frequent communication with many of the schools. We have in each of 9 areas within the state school teams that are set up that are designated to do nothing but work specifically with the schools in their area, the K through 12 schools, to provide them some with guidance and with recommendations around cases. One of the questions we have is what constitutes an outbreak? An outbreak is 3 or more cases within a group or defined setting within a 14-day period. And we use that to kind of gauge what's going on in the schools. That doesn't always mean that that group, that those 3 cases all were exposed or became infected as a result of being in that group. But when we start to see 3 or more cases within a group setting, that actually raises the risk for that group and raises the risk of transmission and exposure. A lot of times when we identify 3 cases, that's usually an indication that there are more cases that haven't yet been identified. So we use that as a threshold. And when we get to that threshold, we recommend that in that setting, all of the students and teachers undergo quarantine. When we rise to a threshold of multiple outbreaks within a school setting in a short time frame, that can often be a trigger for when a school should go virtual. We get a lot of questions about, are we recommending to specific schools that they go virtual or that they do a temporary dismissal. We do have some thresholds, and as far as our general guidance, we'd say that if you have 3 or more outbreaks within your school setting within a couple of week period, or if you get so many children and students and teachers out on quarantine or absences because of COVID that make it difficult to maintain those in-person classes, that you should consider going virtual or doing a temporary dismissal of classes. We recommend that if you do that, that you also make sure that it's for at least a couple of weeks so you can interrupt transmission within the school setting. And that's really one of the reasons that we recommend it. So for schools, when we work with them, we do it on an individual basis and we make recommendations based on their scenario. But we don't mandate that a school go virtual. We don't mandate that a school temporarily dismiss for a certain amount of time. What we do is we work with the school to help provide them with that specific guidance. One of the things that we have been seeing, and we do get a lot of questions about, are we seeing cases in basketball, and is that setting of concern? You know, we've been seeing lots of outbreaks more recently in football settings, in cheerleading, in band, and other extracurricular activities, but we're also seeing transmission that's occurring in the classroom setting. But basketball's particular concern, we have seen clusters and outbreaks in basketball team settings. And, you know, we're worried about that because that's an indoor, very close interaction. And we have seen transmission that's occurred. In some cases, schools have had to quarantine basketball teams for a couple of weeks. In some cases, schools have made the decision to cancel basketball because of the high risk nature of that. And so we are seeing these things showing up in schools now. We're starting to see an impact. I anticipate that as we continue to see these increases in our number of cases, we'll continue to see that impact. So certainly we can open it up to questions. If there's some questions about schools that we haven't covered, we can certainly provide those answers as well.
Why don't we do this? Thomas, can you hear me?
Yes, again.
Okay, so let's look at the